Medicine is changing, and so is the approach to tackling several diseases that were previously deemed untreatable and genetic. With the development and advancement of medicine in genetics and stem cells, diseases such as diabetes, HIV/AIDS, and sickle cells are now becoming treatable. Is this signaling a new dawn for medical treatments? Recent developments in pluripotent stem cell therapy are reshaping treatment options for diabetes, sickle cell disease, HIV/AIDS, and other genetic disorders. While this emerging field offers significant promise, it faces critical challenges, particularly in overcoming immune rejection of transplanted cells. Innovations in gene editing technologies, encapsulation methods, and immunomodulation are at the forefront of addressing these hurdles. What are stem cells? Stem cells are unique cells in our bodies with the remarkable ability to develop into various specialized cell types. They serve as a sort of internal repair system, dividing to replenish other cells as long as the person or animal is alive. Stem cell therapy for diabetes, breakthroughs, and challenges. Clinical success in China. In September 2024, Chinese researchers reported a groundbreaking clinical cure for a 25-year-old woman with type 1 diabetes using chemically induced pluripotent stem cells, or CiPSCs. Adipose tissue cells from the patient were reprogrammed into CiPSCs and then differentiated into insulin-producing islet cells. These were transplanted back into her body, allowing her to discontinue insulin therapy entirely within just 2 months post-transplantation. This procedure eliminated the need for immunosuppressants, reducing risks associated with immune rejection and long-term immunosuppressive therapy. Ongoing trials and immunosuppression. In the United States, companies like Vertex Pharmaceuticals are conducting similar trials using donor-derived stem cells to create islet cells. In their phase 1-2 clinical trials, patients received allogeneic stem cell-derived islet cells and demonstrated impressive outcomes in insulin production and blood glucose regulation. However, these patients required immunosuppressive medications to prevent rejection of the transplanted cells. Long-term use of immunosuppressants carries significant risks, including infections and malignancies. Innovations to overcome immune rejection. To address immune rejection challenges, several strategies are being explored. Gene editing technologies. Researchers are utilizing CRISPR-Cas9 to create hypoimmune stem cells. By knocking out genes responsible for immune recognition, such as HLA proteins, or overexpressing proteins that inhibit immune attack, these modified cells can evade detection by the immune system. Encapsulation devices. Islet cells are enclosed in semi-permeable membranes or capsules implanted under the skin. These devices allow the exchange of insulin and glucose while protecting the cells from immune cells, potentially eliminating the need for systemic immunosuppression. Immune modulation. Some research focuses on engineering transplanted cells to secrete immunomodulatory factors like IL-10 or TGF-beta. This local suppression of immune responses could allow transplanted cells to survive without systemic immunosuppression. Stem cell therapy for sickle cell disease. FDA-approved gene therapies. In late 2023, the FDA approved 2 landmark gene therapies, Casgevy and Lyfgenia, for treating sickle cell disease. These treatments involve harvesting the patient's own hematopoietic stem cells, using gene editing techniques like CRISPR-Cas9 or lentiviral vectors to correct the defective hemoglobin gene, and then reinfusing the modified cells back into the patient. The result is the production of healthy red blood cells, significantly reducing or even eliminating vaso-occlusive crises, a severe complication of sickle cell disease. Challenges in accessibility and conditioning. Despite their efficacy, these therapies face several challenges. High costs. Treatments cost between $2 and $3 million per patient, limiting accessibility, especially in low-resource settings. Myeloablative conditioning. Patients must undergo high-dose chemotherapy to eliminate existing bone marrow before transplantation. This process is risky and necessitates immunosuppressive drugs to prevent complications like graft versus host disease. Such intense conditioning limits availability, especially in regions with limited medical infrastructure. Donor matching and risks. Finding matched donors is difficult, and the procedure carries risks, including rejection and complications from immunosuppressive therapies. Efforts to enhance safety and accessibility. Researchers are exploring methods to reduce or eliminate the need for aggressive conditioning and immunosuppression. Immune modulation techniques. Developing protocols to modulate the patient's immune system, potentially accepting transplanted cells without extensive chemotherapy. Gene editing advances. Refining gene editing techniques to increase efficiency and reduce costs, aiming to make therapies more accessible globally. Global initiatives, organizations like the NIH and the Bill and Melinda Gates Foundation, are working to make these therapies affordable and available worldwide. Stem cell therapy for HIV/AIDS. Functional cures through stem cell transplants. Stem cell therapies have led to functional cures in a small number of HIV/AIDS patients. Notably, the Berlin and London patients were effectively cured after receiving stem cell transplants from donors with a natural CCR5 delta 32 mutation, making their immune cells resistant to HIV infection. In 2024, a seventh case was announced at the International AIDS Conference, a German patient free of the virus for over 5 years without antiretroviral therapy. While promising, this approach has significant limitations. The treatment involves high-risk procedures, such as risky stem cell transplants, which are suitable only for patients with severe health conditions like leukemia. Additionally, finding compatible donors with the CCR5 delta 32 mutation is rare. The procedure also requires the use of immunosuppressive drugs, increasing the risks of infections and malignancies. Current research aims to overcome these limitations. Scientists are using gene editing technologies like CRISPR to modify patients' own stem cells by introducing the CCR5 mutation. This could potentially make them resistant to HIV without the need for donor cells. Efforts are also underway to develop scalable treatments that are less risky and more accessible without the need for immunosuppression. This could make the treatments applicable to a broader patient population. A significant hurdle in stem cell therapies is the requirement for immunosuppressive drugs to prevent rejection. Long-term use of these drugs can lead to severe complications, such as infections and cancer. Strategies to mitigate these issues include gene editing for immune evasion, where hypoimmune cells are created by knocking out genes responsible for immune recognition. This allows transplanted cells to evade the host immune system without global suppression. Another approach is encapsulation technologies, which involve encasing transplanted cells in biomaterials to shield them from immune attack while permitting essential functions like insulin secretion. Lastly, immune modulation involves engineering cells to secrete immunomodulatory factors, locally suppressing immune responses and potentially eliminating the need for systemic immunosuppression. Ethical and practical challenges include cost and accessibility. High costs of stem cell and gene editing therapies limit widespread adoption. Treatments costing millions per patient are impractical for most healthcare systems, especially in low and middle-income countries, hindering global accessibility. Long-term safety. Concerns about the long-term safety of genetically modified cells include potential unintended genetic alterations and increased cancer risk. Rigorous, long-term studies are essential to fully understand and mitigate these risks. Ethical considerations. Stem cell sources. While induced pluripotent stem cells, or iPSCs, alleviate concerns associated with embryonic stem cells, ethical debates persist around the use of gene editing technologies. Gene editing ethics. Issues such as off-target effects, genetic privacy, and potential germline modifications raise ethical questions. The possibility of misuse of technologies like CRISPR necessitates careful ethical scrutiny and regulation. The future of stem cell therapies. Advancements in stem cell therapies for diabetes, sickle cell disease, and HIV/AIDS highlight the potential to revolutionize treatment for chronic and genetic diseases. Ongoing research is expanding into other conditions, including genetic disorders, exploring treatments for muscular dystrophy, cystic fibrosis, and other inherited conditions. Neurological disorders, investigating the use of stem cells to treat neurological diseases and injuries, such as spinal cord injuries and neurodegenerative diseases. Regenerative medicine, utilizing stem cells to regenerate damaged tissues and organs, offering hope for conditions like heart disease. Global collaborative efforts. Partnerships among governments, research institutions, and philanthropic organizations aim to make these therapies more accessible and affordable. Initiatives focus on developing scalable treatments that can be implemented worldwide. In conclusion, recent advancements in pluripotent stem cell therapy are opening doors to potentially curative treatments for diseases long considered incurable. While challenges related to cost, accessibility, immune rejection, and long-term safety remain, ongoing research and innovation are paving the way towards safer and more effective treatments. Ethical considerations continue to be paramount as the field advances, ensuring responsible use of these powerful technologies. With continued progress in gene editing technologies and regenerative medicine, stem cell therapies may soon offer transformative solutions for millions worldwide, potentially becoming a routine part of medical practice.